Hello everyone. First of all, just to do like a quick debrief, okay? The reason why I wanted to show the the treatment of acupuncture in this kind of issues is because most of the people think about acupuncture treating only pain, and actually it treats a lot of disorders. And sorry, my kid just came in. So the thing is, acupuncture can do excellent results, and a lot of people think, okay, maybe more herbs in this kind of things, or Western medicine because acupuncture is not effective, and actually it's not true. And because I work exclusively with acupuncture in clinic, almost exclusively, I've been seeing that acupuncture can really help. So this is the main reason why I wanted to present acupuncture for this kind of treatments. So I brought to you guys three cases, three completely different cases, and also with different approaches. Also to show that acupuncture is actually really flexible. So there are many techniques, there are many things that many ways how you can work and solve a problem with acupuncture. So there's a balance method, there's the tongue acupuncture, there's cranial systems, the Japanese systems. There's so many ways that acupuncture can help um, treating people. So also the three cases that I'm going to show, it's an example of that. Is even myself, I sometimes can solve things in different ways. Okay. Just one last thing, because I'm not sure of the people that are listening if they are all familiar with Chinese medicine or not. So it's like emotional issues. It's like Shen disorders. We have like the three kinds of big energies, like Shen, Qi, and Jing. And Shen is more related to consciousness, to emotions, etc., etc. So when we deal with emotional issues in Chinese medicine, we are dealing with the Shen. So we are trying to find a solution, trying to balance the body, because at the basis, every disease in Chinese medicine is an imbalance of Qi. Okay, so we want to balance Qi, and this we will see at the end with Qigong, that the approach is really a global, really interesting, because in the end we only want to balance Qi, and everything will come together. So I want to show you my first case that where I used the balance method, that it's really known and famous from Master Tan. Okay, so this is a female patient that I received a couple of years ago, and she suffers from chronic depression. Okay, she has several issues like irritable bowel syndrome, headaches, tension in the neck, headaches, so a lot of issues. But the main issue that she brought to me was because she was feeling even more depressed and anxious, and a lot of tension in the neck. So this is one of the funny things or interesting things of the balance method that I will introduce you at the same time I introduce this case, is that in the balance method, we try to find the correct channels, the channels that are affected, that are diseased, in order to correct them or to balance them. So there is like a system, and every channels connect to each other, so they can balance each other's in a certain way. Okay. So if you are seeing the case in front of you guys, you can see that there's a like a person drawn. Okay, we will say it's the patient. Okay, and then you have points in pinyin, the points that I use. Actually, it's the protocol. Okay, that I use, and then you have letters in red that are the name of the channels. Actually, so that I choose what we call in the balance method a pattern. So it's a connection between, in this case, four channels that balance each other and are able to balance the Qi in a general way. Okay, so what we can see from the balance method here is that we have like a structural building that's like that. Each member has a channel that is treated. Then there's an alternation between yin and yang to create a dynamic of recovery. Okay. And then of course there's the choice of the points. And here I put some of tongue acupuncture points that are really interesting and strong. Okay, so to summarize, because I don't want to enter too much, the symptoms that the patient had, for me, it was a little bit of yang deficiency. So that was provoking in this patient like sadness and tiredness, and she also had like cold limbs, extremities. So I used what you see, the points above the head. It's like Bai Hui, Shen Ting, and Yin Tang that are all on the same line. It's Du Mai. It's like the big channel of the yang energy. And by doing this, what I've done is that I act on three points that are close to each other, acting a little bit like a Daoma, that it's like a tongue technique. So it stimulated a lot the yang energy in this main channel, and of course it contributed to the body to build up more yang energy. Okay, so these 3 points that I used actually were really important in the treatment. Also, all of these points have an action on anxiety, more stress and anxiety actually. Okay, and then the red letters that you see, it's like the pericardium channel that has a really strong connection to emotional issues. And then I put another point that it's named Tong Li, it's the heart channel. So I put another point beside. And then I associated with the Sanjiao, spleen and stomach. And in this way, I tried with a couple of, for those who understand Chinese medicine, will see that some of the points are not from this channel, but it's like to create a synergy, okay? And what I want to show is that this person suffered from depression for a lot of years. It's like a chronic depression. And when she came to see me, she was really bad. And only after 3 treatments, that is, I think, the more important thing for people to understand, that not always happens like this, of course, but it can also happen. So it means that even with acupuncture, okay, we are balancing the body, and the emotional state changes. And this patient, after 3 treatments, she decided by herself, against my will, because I'm not in favor of it. She stopped taking her pills, because she took anxiety pills, antidepressants, and she decided to stop because she felt so well. Okay, I eventually had to say to her that it was dangerous because she could have a refall later on. Okay, that actually happened, but it shows at the same time that acupuncture was so strong in an emotional level that she was okay. So I hope this can break some barriers in a sense, because a lot of people, common people, and even some colleagues think that acupuncture is not so strong acting on emotional cases or depression. And this is one example of many that where acupuncture actually helps. Okay,